So this is the last section in your chapter 7. We are going to talk about your nose, and we're going to talk about your mouth and how your sense of taste and your smell are related to each other. So we're going to see kind of answer these two questions, which is how can a particular smell trigger your emotion, and how does the sense of smell influence taste? So the first thing we're going to talk about is your olfactory sense, which is your sense of smell. So first of all, when you have a cold, you probably notice that you can't smell as well as you normally can. And that's because you have these sensors that are very small, and they're located in a specific region, and it's a pretty small region. And this region is called your olfactory region. And this is going to be at the top of each of your nasal cavity. The sensors that are located in the olfactory region are called your olfactory receptor cells. Now, these cells usually are covered with mucus when you have a cold. And so when they're covered with mucus, they can't do their job very well. And therefore, the smells that come in that are made up of odor molecules, they can't actually reach the receptors itself. Therefore, you're not able to distinguish what you are smelling. And these olfactory cells are actually neurons. And remember when we talked about neurons in the previous chapters, they are the ones that have the axon terminals, and they're able to communicate with one another, and are able to send signals from one area to another. So your olfactory, going on along with the olfactory region, there's also something called olfactory hairs. These are the ones that are actually going to connect to the neurons and go into the nasal cavity of your face. And they're going to be covered with a very thin but protective layer of mucus. Okay, so that's what your olfactory hairs are pretty much are. So when you smell an odor, what's going to happen is first, the odor is going to dissolve in this protective thin layer of mucus that's on top of the hairs. And this dissolving factor is actually going to stimulate your olfactory receptor cells, which are the neurons. These neurons are going to send impulses through the olfactory filament that make up the olfactory nerve. So the thick part of the olfactory nerve is called the olfactory bulb. And when it receives impulses from the olfactory filaments, they are going to send the message or the stimulus to your olfactory part of your brain called the olfactory cortex. Okay, so there's something called the limbic system in our body. This is pretty much where our emotions come from. And they're going to have nerve pathways that are going to go through your limbic system that's going to travel between your nose and your brain. And that's why smells can actually trigger emotions, because they have to travel through the limbic system, which controls our emotions. And so sometimes you might smell something like, I don't know, a piece of clothing, and it might remind you of somebody that you love, or you might smell like some kind of medication and remember when you were really sick. I remember when I had food poisoning and my mom cleaned the bathroom with bleach, so every time I smell bleach, I remember when I was sick with food poisoning. Or there's certain types of candles that I only use at Christmas time, so when I smell those candles, I remember Christmas, and so on and so forth. Now, you only need a couple odor molecules. That can trigger your olfactory receptors that can, remind you of a smell very easily. And sometimes, just couple olfactory receptors can also, you can get used to the smell over time. So you might be using a perfume that you might have forgotten that you're wearing because you're so used to it. But you're walking by someone and they might say, hey, you smell really good. And you're like, oh, really? And then you're like, oh, yeah, I sprayed myself with perfume that you can no longer smell. So you can look at figure 7.14 and then kind of distinguish these two questions, which is labeled part, which label part is covered with mucus in a cold, we said that this was going to be your olfactory receptor cells. And then why does this affect your sense of taste? Because, they're both related to each other. So if you can't process the sense of odor molecules that are coming through, you're not being able to connect with the stimulus that's being sent from your nose. Okay, injuries and disorders of the nose. So remember, your nose is like a filter system. It catches all the debris that you might be inhaling that's not good for you in your lungs. And then you can also have issues with your nose, such as a deviated septum, which is more serious, or just a cold, which can, both of which can cause you to have breathing problems. And this is basically what I said. Nose is a filtering system so that you're protected from irritants and germs. So the first thing is called rhinitis. Might think of a rhino. Basically, this is when you have inflammation of the mucous membranes that line your nasal passage. What is a cause? You can have it caused by simply a common cold. But honestly, anything that irritates the membrane of your nasal passages can cause you to have rhinitis. So things like an infection, allergies, chemical odors, or drugs. And so when your nasal passages are irritated, you have something called histamines that get released. And these histamines are going to trigger a reaction that causes nasal congestion or drainage, which is, you can have postnasal drip. You can have I call it a leaky nose when you have a runny nose. And the best treatment is just using antihistamines, and that will just act against the histamines that are being produced in your body. If you hear a little baby in the background, that's Anna saying hi. She is currently rolling on the floor. Not really rolling, because she can't roll yet. Anyway, so a septum is basically the cartilage that you can literally feel. It's like the bridge of your nose that divides the left and right air passages in the nose. And this can be deviated. A deviated septum can also be mainly caused because of an injury, but other things can, sometimes it can be a birth defect as well, but it can be surgically repaired, which is a good thing. There's also another thing called perforated septum, which is basically when you have open ulcer in your septum, which can be caused, again, by injury, some kind of, toxic fume exposure, drug use, and this can also be fixed surgically and help to close the open sores, which can be very painful and irritating. So let's do our check your understanding. First, where are the sensors of smell located? Remember, they're located in the olfactory region, which is a very small area on top of each of your nasal cavity. What is the connection between smell and emotions? Remember that those nerve pathways go through the limbic system, which is how it's relating the smell, which is taken in by your nose, and then relating it through the limbic system, which is in charge of your emotions. What is the most common cause of rhinitis? Simply the common cold. What are the two basic treatments for rhinitis? It's either taking antihistamines, which are just your allergy medicines and things like that, or just removing whatever the irritating smell could be. And then what might cause a perforated septum? This is when you have like the open sores in your septum, which can be can be caused by drugs, exposure to toxic or chemical fumes, and things like that. Your gustatory sense, which is also the sense of taste. Let's talk about that. So obviously we know that taste buds are located in your mouth. They can be on the sides of your mouth, on your lips, on your tongue. And the taste buds that are located on your tongue are called papillae. Your mouth has over around 10,000 taste buds, which are your sensory receptors. So your taste bud has something called taste pores. Hold on, let me go to the next slide. So your taste buds have something called taste pores, Your taste pores are made up of gustatory hairs, which kind of poke through the taste pores. And the gustatory hairs are made up of gustatory cells. You also have salivary glands that are inside of your mouth, and these are the ones that produce saliva. So when you have chemical molecules from something that you eat or drink, they are going to mix with the saliva and they're going to make something called a testance. And these are basically what are going to stimulate your gustatory hairs inside of your taste buds and send nerve impulses to the brain. Now you have three nerves that can be, that are involved in the taste sensations. You have facial, glossopharyngeal, and then your vagus nerve. And all of these will send taste sensations to the brain. Okay. So, there are 5 basic tastes that we can actually distinguish. There's salty, sour, bitter, and then sweet and umami. And people describe this as the taste of beef and also the taste of monosodium glutamate, which is basically a lot of the things that are in the processed foods that you eat. But another thing to know is that each of your taste buds has about 50 to 100 gustatory cells. And each of those gustatory cells are responsible for one of the taste sensations, whether it's salty, sour, sweet, bitter, umami, whatever. And so each of your taste buds can actually have and be able to distinguish all 5 of those sensations because you have so many of those gustatory cells located in them. What do you think you like the taste of why do you think you like the taste of certain foods and not those of others? So, the food that we eat have different textures. They give off different odors. They have different temperatures. And so when our saliva interacts with these different foods, they kind of give us a different taste. So taste is basically the combination of what we are getting from our taste buds in our mouth and then also how we are smelling it with our olfactory senses. There are also certain tastes that we actually can't distinguishly recognize on their own, such as chocolate, peach, tomatoes, limes. But these we can say that, oh, this tastes like peach, this tastes like tomato, because of the combination we have from the smell and the texture or the taste of it. Which is really cool because I didn't even know that until I was reading up on this. But the way that we, distinguish what chocolate tastes like is not because we know what chocolate tastes like, it's because of how our senses combine to form that taste. Okay. Another cool thing before I move on to this is that spicy food actually not only stimulates your gustatory cells, but also stimulates pain receptors in your mouth. And different people have different levels of how they perceive pain. And so the reason people like certain people like spicy food more than other people is because of how well they can tolerate the pain that they are getting from the spice level of the food. Okay, so let's talk about some disorders of the tongue. There is something called a hairy tongue. Now, this is not like actual hair growing on your tongue, but this actually has to do with the gustatory hairs that are in your taste buds of the tongue. And this is when they are growing in a rapid way. And this can be caused by poor oral hygiene. It can be a reaction to a medication. Sometimes people who drink a lot of caffeine in coffee or tea, drugs like tobacco, sometimes treatment for certain diseases like cancer, radiation treatments, they can cause a hairy tongue. there is a prevention. One is taking good care of your mouth, cleaning your tongue. A lot of people, when they brush their teeth, they don't actually know that you're supposed to brush your tongue as well. And that is a way to keep your tongue clean and therefore prevent certain disorders of your tongue. So just a quick tip, when you brush your teeth, you should, also brush your tongue. There's also something called a burning mouth syndrome. And this is kind of like when you literally could feel your mouth is burning or like itchy, tingling, dry. It could be like a metal, bitter taste. And this can last for a couple weeks, or it can last for a couple years. And it can actually cause anxiety and depression. And the best treatment for this is one, figuring out what is causing it. Sometimes you can have nutritional supplements like vitamins that can help with that, hormone therapy, antibiotics, and then, there are some just remedies of home remedies that can help also. And the basic thing is you want to reduce the pain or the symptoms that it's causing. All right. What are the papillae? We talked about papillae are pretty much the little bumps on your tongue. That is where the taste buds reside, or also known as your taste buds. Name 3 nerves responsible for sending taste sensory signals to the brain. We talked about the facial, the glossopharyngeal, and then the vagus nerve. So this is going to complete our chapter 7. I hope you guys enjoyed learning about your eye, your ear, and your taste and smell in kind of a glimpse, and that, you can kind of refer to these things as they occur day-to-day life.